Good morning friends, I am Dr. Harshavardhan Ghorpade from the Department of Visual Sciences, DOVS, Fortis Hospital, Vashi, Navi Mumbai and Saroj Specialty Eye Clinic, Vashi, Navi Mumbai. Today I am going to speak to you about retinal disorders, especially diabetic retinopathy. Now retina is the innermost layer of the eye. It is the light sensitive layer. It's the layer where the image of the light is formed and then transmitted to the brain. Any damage to this layer leads to blurred vision. The most important sensitive part of the retina is the macula, and the centermost point is called as the fovea. If there is any collection of fluid or blood or damage to this part of the retina, it leads to blurred and even blindness of vision. So there are various disorders that can affect the retina. That could be infections, inflammations, retinal detachments, injuries and various other disorders which ultimately lead to blurred vision. Specifically speaking, if we talk about diabetic retinopathy, it is a disorder where diabetes leads to blockage and leakage of blood vessels in the retina. Now this blockage leads to hypoxia, which means less oxygen supply, which in turn leads to formation of new blood vessels, and these new blood vessels can break, rupture and bleed, leading to blindness. The other part is leakage. Leakage is because the blood vessels become leaky due to blood sugar in the blood, as a result of which fluid starts accumulating in the central area, as I said, the fovea and the macula. This leads to initial blurred vision. However, for a long time later, it can lead to scarring and finally complete loss of vision at the center. So, the most important thing in diabetic retinopathy is screening. There is no symptom of diabetic retinopathy. The patient does not have any problem till it actually occurs, and therefore patients with diabetes for more than 5 years and patients with congenital diabetes or juvenile diabetes from the first year itself need to be screened every year. If we find any changes in the retina, then the patient may have to be screened every 6 months or even at 3 months, because every small change has to be monitored. This monitoring can be done by various instruments like simple fundus camera, or it can be done by lenses, and most new instruments have now we use is the OCT, which is a scan of the retina and which gives us the idea of the thickness of the layers, and if there is any leakage, the layer thickness can increase. When we come to know about any changes in the retina through all these apparatuses, then we can definitely warn the patient, and we can even do preliminary treatment. The early treatment can be done by simple laser machines, which is a OPD based procedure where we can block these blood vessels which are leaking and prevent further loss of vision, because as the fluid starts accumulating, it can come to the center of the retina, which is the most sensitive area. However, if the bleeding is more, we might even need a surgery. This surgery is called as vitrectomy. In vitrectomy, what we do is we cut the central area of the jelly that is present in the eye and remove all the blood that is collected. This is followed by laser therapy to the areas which are leaking, and then follow-up is needed. There are other treatments also available, in which if there is a mild swelling in the center, we just give injections which stop the leakage. One or more injections may be required. These are called as anti-VEGF injections. Example is Lucentis. Now, once we treat the patient with injections, lasers or surgery, we need to be sure that the patient is followed up, because the diabetes is going to remain throughout their life, and therefore retinopathy can come again at different parts which have not been treated. The most common treatment for severe diabetic retinopathy is pan-retinal photocoagulation, or PRP, which means retinal laser is given to the entire retina in 3 steps. This results in coverage of the whole retina, and therefore the chances of diabetic retinopathy affecting any of the parts is less. However, it can affect your night vision and peripheral vision, which is a side effect of the therapy. Apart from this, we should be careful that during injections and operations there should not be any infections, because a diabetic patient is always prone to more infections. All this care has to be taken by the doctor as well as the patient, because it's a combined effort in preventing blindness due to diabetic retinopathy. Hence, I appeal to you that every time any patient is detected with diabetes, a yearly screening of the eyes is a must, and follow-up treatment, if required, has to be done without any delay. Even a delay of few weeks can lead to permanent blurring of vision. Thank you very much, and I hope you enjoyed my video. If you want to know more about me, please contact me on librate.com. Thank you.